This, in front of me, is the death certificate.
Nicole's mother was among the 5,000 seniors who died during the first wave of the pandemic. But what killed her wasn't the virus.
8 days before her death, the doctor called to inform me that my mother was completely dehydrated.
The place is shut down by authorities. Ilda, who was fine a few weeks before, has now been left to her own devices. There is not enough staff. Those who are left are completely overwhelmed. Nicole installed a webcam to watch over her mother from home. She finds troubling images like this. Ilda seems to not have enough help to eat or even sip from a glass of water. 20 minutes later, the attendant takes the glass away. It's still full.
I was following her on the camera that I installed in her bedroom. From afar, I could see she was suffering, but not them. I had to call the head of the unit, the coordinator, to say, "My mother is suffering, do something."
From her phone at home, Nicole feels helpless as she watches her mother die away.
They still allowed me to go see her. I spent 45 minutes with her on the Saturday before her death, then Sunday. It smelt like death in there. It was really grim.
Like most families in that situation, Nicole didn't get to bury her mom. All she had left was her sorrow and a burning question. How come nearly 3/4 of Quebec's COVID-19 victims were living in these nursing homes?
They were no longer treated like people. They were only numbers. The CHSLD was not ready at all for this crisis.
Not ready to face the crisis. Several inquiries have reached that same conclusion across Quebec and other provinces, including Ontario, where the pandemic's third wave rages on. The province has shut down. The third wave has hit Toronto so hard it has displaced Montreal as the epicenter of the pandemic. Candace Rennick has worked in seniors healthcare for 20 years. She believes we didn't learn from the mistakes of the first wave.
What our members are experiencing is complete and total burnout. There is a crisis at the bedside and they've received little to no support. From the first wave to the second wave has gotten worse because we've lost people. People have left the industry. They're no longer working in long-term care, and the government has done nothing to retain and attract staff. So in fact, the crisis has gotten much worse.
The network is under pressure. Here, the second wave has claimed more lives than the first. For-profit healthcare companies such as Extendicare have seen large-scale outbreaks in the nursing homes they manage. Extendicare first accepted a request for an interview but backed out last minute. Researcher Tamara Daly believes it's high time these companies' business model is reviewed.
Public and nonprofit homes are putting money back into their homes, whereas the for-profit homes take funding out. So they're not adding to their staffing levels in the same way that you would find with public and nonprofit homes. What the pandemic really showed was that those homes that were already doing things that were not necessarily meeting standards, they fared worse overall. In Canada, we don't tend to really value older people, like just as a general rule.
Back in Quebec, there's light at the end of the tunnel. Seniors living in nursing homes were among the first to be vaccinated, and now among the first to enjoy some social activities.
I have a little dog who comes to visit. We can go out here, on the patio. You know, the small pleasures of life. It's nice. But I'd prefer to go out, go to a restaurant, grab a glass of wine with friends.
Quebec is still partially under lockdown, and like in the rest of Canada, vaccination here is a race against the spread of COVID-19 variants. The provincial government has also unveiled major investments for seniors.
Here, for 356 residents, we had 4 heads of unit who cared for 90 residents and as many employees. Now we have 8. There's awareness now. We also see what the vaccine is doing. There's an effect. So that gives us hope.
Quebec's health ministry is promising an exhaustive action plan and the end of private facilities without government funding. In Ontario, an independent public inquiry commission on long-term care services released its conclusions. There was no plan to protect residents in long-term care.